Good day to you. We are going to speak about hematology and the patients with bleeding disorders and their relation with the dental practice. This topic is very important for dentistry because dental procedures resulting in bleeding can have serious consequences in patients having bleeding disorder. They can lead to severe hemorrhage up to death. The normal values are very important to know by dentists. Normal RBC count in males 4.5 to 5.5 million per millimeter cube, and in females it's 4 to 5 million per millimeter cube. Normal hemoglobin concentration 13 to 17 grams per deciliter, and the white blood cell count 4,000 to 11,000 per cubic millimeter, and finally the platelets, the normal count is over 150,000 per cubic millimeter. Anemia. Anemia is a reduction in the oxygen carrying capacity of the blood. It has got two causes, or two manifestations, let me say that, either decreased the number of red blood cells or decreased amount of hemoglobin, or both. The causes are decreased production, and this can occur with deficiency states, like deficiency of all raw material needed for the synthesis of the red cells, like proteins, iron, folic acid, and vitamin B12, bone marrow inhibition or bone marrow aplasia, and chronic diseases like chronic renal failure, in which there is low amount of erythropoietin. Second cause, increased destruction or hemolysis, hemolytic anemia, like we see in malaria, sickle cell disease, thalassemia, glucose 6-phosphate dehydrogenase enzyme deficiency. 3. Loss of blood as a result of bleeding, hemorrhage, whether acute or chronic. Koilonychia, which is spoon-shaped nails. We see this picture, this spoon-shaped nails in severe iron deficiency anemia. Dental considerations of anemia. There are two problems with anemia. First problem is the problem of delayed healing. Second problem is the problem of general anesthesia. General anesthesia is contraindicated in a patient with anemia. For the problem of delayed healing, prophylactic antibiotics can be given before the dental procedure to attain an optimum level of antibiotics in the forming blood clot. This can sometimes overcome the problem of delayed healing, but the other problem, which is the no general anesthesia or even intravenous sedation, you cannot do general anesthesia except after correcting the anemia. For example, in iron deficiency anemia, you have to give iron. Nitrous oxide sedation should be avoided in cases of pernicious anemia due to deficiency of vitamin B12 or folic acid. Hemolytic anemia. The causes are either extrinsic, like malaria infection, or the problems with hemoglobin, intrinsic problems with hemoglobin, like sickle cell disease, thalassemia, glucose 6-phosphate dehydrogenase deficiency. In sickle cell disease, there is an abnormal hemoglobin called hemoglobin S. Whenever there is decreased oxygen tension, we get sickling, which is distortion of the shape of RBCs to be like the shape of sickle appearance. This sickling decreases the plasticity and elasticity of the cell membrane of the red cells, and this predisposes to hemolysis or destruction of the red blood cells prematurely. Instead of living for the normal 120 days, we may find the lifespan of RBCs reduced to only 14 days. What are the conditions where we get decreased oxygen tension? Number 1, increased atmospheric pressure, like diving. Number 2, low oxygen in the air, like in high altitudes or in strong extreme exercise. And number 3, dehydration. What is the dental consideration? Local anesthesia is preferred because general anesthesia is contraindicated in a case of anemia, and if we need to do general anesthesia, then we have to correct anemia, restore hemoglobin even by blood transfusion. Thalassemia, it's a hereditary hemolytic anemia. in which there is an abnormal hemoglobin. And the abnormal hemoglobin in thalassemia is the persistence of the fetal hemoglobin after birth. There's a problem of increased hemolysis all the time. There are certain manifestations characteristic like hepatosplenomegaly because of increased rate of destruction of red cells in the liver and spleen, growth retardation, and thalassemia facies with protruding premaxilla due to increased activity of the red bone marrow present inside the maxilla, and this is the case also in all other sites of the red bone marrow. The dental consideration: if the hemoglobin is below 10 gram per deciliter, it's not advised to treat this patient. He has to elevate the hemoglobin before dental treatment because bleeding may occur and the hemoglobin concentration may fall even below 10. Consult the hematologist of the patient. Make the dental appointments short if possible. And the best time for dental treatment after blood transfusion. The hemoglobin will be adequate and the condition of the patient will be better. In children who have done splenectomy, it is advised to give them antibiotic prophylaxis. These are the pictures of the thalassemia children with protruding maxilla bone. The only treatment for the thalassemia children is blood transfusion, and we can see the hematology clinic in many general hospitals full of these patients who have to take their blood transfusion even something like 3 times per week. The glucose 6-phosphate dehydrogenase deficiency. It's a metabolic disturbance in RBC where the enzyme glucose 6-phosphate dehydrogenase is deficient. In case of accumulation of oxidizing agents, oxidants like infections or certain drugs or even fava beans, this produce methemoglobin and cause denaturing of hemoglobin and destruction of the red cell, hemolysis. Examples of oxidants like antimalarials, sulfonamides, and many non-sulfa antibiotics, and certain analgesics like aspirin, phenazopyridine, and acetanilide. Dental consideration: local anesthesia is preferred. In polycythemia, there is overproduction of the red cells, and this can occur with any cause of hypoxia, like in cardiac or respiratory diseases. The complication is high risk of thrombosis, and this condition is controlled by frequent bloodletting or asking the patient to donate his blood 3 times a year at least, or the other option by cytotoxic drug therapy. Leukemias. Leukemias are divided into acute and chronic. In acute leukemia, there are 2 types: acute lymphoblastic leukemia and acute myeloblastic leukemia. In chronic leukemia, we have chronic lymphocytic leukemia and chronic myeloid leukemia. So the difference between acute leukemia and chronic leukemia is in the type of the cell which is affected. In acute leukemia, it's a blast cell, it's an immature cell, while in chronic leukemia, it is a mature cell. What are the dental considerations in leukemia? Before treating these patients, we have to consult the hematologist. Best time for dental treatment is during the time of remissions and between the chemotherapeutic regimens after making sure that the white blood cell count is optimal. Thank you very much.